Hello, my name is Nana Mokhtari and today is September 9th, 2019. Today we're going to talk about synovial joints, specifically the synovial joints within a chicken wing. Just an overview, synovial joints are the most common type of joint in the body. A key structural characteristic for a synovial joint is that it has a presence of a joint cavity. This fluid-filled sac in the site of which the articulating surfaces of the bones contact each other. Also, unlike fibrous or cartilaginous joints, the articulating bone surfaces of a synovial joint are not directly connected to each other by fibrous connective tissue or cartilage. This gives the bone of a synovial joint the ability to move smoothly against each other, allowing for increased joint mobility. Friction between the bones of a synovial joint is prevented by the presence of this articular cartilage. A thin layer of cartilage that covers the entirety of a bone, or the articulating surface of each bone, specifically. Lining the inner surface of the articular capsule is a thin synovial membrane. The cells of this membrane secrete synovial fluid, which is more like a thick, slimy fluid that provides lubrication to the articular cartilage, which does not contain blood vessels. Synovial joints are subdivided based on the shapes of the articulating surfaces of the bones that form each joint. The 6 different types of synovial joints are pivot, hinge, condyloid, saddle, plane, and ball and socket joints, which we'll see a couple of those when we look more closely at the chicken wing. Now let's take a closer look at the synovial joint specifically in each of the parts of the chicken wing. As you can see, the chicken wing is similar to the human arm, with the tip similar to the hand, the wrist, the forearm or the lower ring, the elbow, and the shoulder, which is synonymous with the upper drumstick area. Similar to the human arm, the chicken wing has a humerus along this aspect, a radius, and an ulna, and some phalanges. And as mentioned before, the synovial joint has different types based off the shape of the articulating surface. And the chicken wing, for instance, at the very top where the shoulder area would be if compared to a human arm, is the ball and socket. This is mostly the ball area, which is at the tip of the humerus. And it allows for the formation to form a ball and socket. This being the ball, the socket being where the shoulder would be attaching it to the trunk of the body. This ball and socket joint allows for joint mobility with abduction and adduction and range of motion of the ring. The next joint that we're going to look at is the hinge joint, which is displayed right here in the middle, which is located near the metaphorical region when compared to the human arm, would be the elbow area. The hinge joint is made up of the radius, the ulna, connecting to the humerus, which allows for bending and extending the wing. The next joint that we're going to look at is the condyloid joint of the chicken wing, which is similar to the wrist of the human anatomy. This joint is made up of the radius, the ulna connecting to the phalanges and the rest of the wing. The condyloid joint allows for flexion, extension, and range of motion of the wing. Now let's take a different look at synovial joints. Let's focus on the pathology of synovial joints. There are so many different kinds of diseases and issues that could affect synovial joints, but one of the most common ones is arthritis, which is a disorder that affects synovial joints that involves inflammation of the joint. Some symptoms of arthritis involve joint pain along with swelling, stiffness, and reduced joint mobility. Arthritis may arise from aging, damaged articular cartilage, autoimmune diseases, bacterial or viral infections, or even genetic causes. Although there are hundreds of different types of arthritis, the most common type of arthritis is osteoarthritis, which is associated with the aging and wear and tear of that articular cartilage that we mentioned before. Risk factors that may lead to the osteoarthritis could include jobs that include physical labor, sports with running, twisting, throwing actions, and even being overweight because they put a lot of pressure on those joints. These factors put stress on the articular cartilage specifically that covers the surface of the bones and of the synovial joints, causing the cartilage to gradually become thinner. As the articular cartilage layer wears down, more pressure is placed on the bones. The joint responds by increasing production of that lubricating synovial fluid, but this can lead to swelling of the joint cavity, causing pain and joint stiffness as the articular capsule is stretched. The bone tissue underlying the damaged articular cartilage also responds by thickening, producing irregularities, and causing the articulating surface of the bone to become rough or bumpy, which also further exacerbates the limited joint mobility and even inflammation. But let's take a closer look. When looking at the chicken wing, especially in the ball and socket area, we see the bone right here. Covering that bone would be the articular cartilage followed by the synovial membrane. Between this bone and the next bone, there would be a articular capsule, which would also include the synovial fluid that would allow for space between the two bones and allow for joint mobility. Thank you so much for listening. Have a wonderful day.